Schizoaffective disorder is a rare psychotic disorder with a prevalence of 0.3%. A person with schizoaffective disorder experiences major mood disturbances for the majority of the time that they are ill with the symptoms of schizophrenia. To be diagnosed with schizoaffective disorder, a person must meet the criteria for schizophrenia and experience an interrupted period of illness during which they also experience a major depressive episode or manic episode. So, a person who is experiencing the delusions and hallucinations of schizophrenia could also experience a depressive episode, characterized by loss of pleasure, depressed mood, increased guilt, decreased concentration, and decreased sleep. Alternately, a person experiencing schizophrenia could experience a manic episode, with increased goal-directed behavior, euphoric mood, decreased need for sleep, and grandiosity. The symptoms meeting the criteria for a major mood episode are present for the majority of the lifetime duration of the active and residual portions of the illness. Since the symptoms of a major mood episode, like mania and depression, can overlap with those of a psychotic disorder, the diagnosis is tricky, requiring a period of at least 2 weeks where delusions or hallucinations are present in the absence of a major mood episode. Schizoaffective disorder is highly heritable and may have a first-degree relative with the disorder. Schizoaffective disorder affects both emotions and thinking, but will involve thinking more than an individual experiences mood symptoms. For example, if a person with bipolar disorder has a manic episode with psychotic features, they might have delusions that they are being recruited for a secret mission and spend all night looking through books for secret messages. As their mania comes down, the delusions will typically start to fade. A person with schizoaffective disorder with bipolar type may have the same delusions and stay up all night. Once they come down from their mania, they will often experience recurring delusions of being recruited for a secret mission. Treatment includes antipsychotics and mood stabilizers like lithium and valproic acid to target psychotic and mood symptoms.